going to be your nurse practitioner today. Today we're going to go ahead and do a partial toenail removal for your ingrown toenail. We're going to do that with a digital block to numb you up. Some risks and benefits of that you will need to know for your informed consent that we have on file. The risks of a digital block would be infection, bleeding, distal paresthesia that can be caused by hitting the nerve, or infarct caused by hitting the artery. These are all small risks that can be decreased with proper technique. And the benefit of a digital block obviously would be pain control. You're not going to experience a lot of pain during this procedure. And then as far as the toenail removal, risks of this procedure would be infection to the area, laceration of the nail bed, altered appearance, and obviously benefits being that it's going to decrease your pain and swelling to your ingrown toenail. So we're going to go ahead and get started as long as you consent to this procedure.
Yes, I consent, and I've signed.
And you've signed. We have that on file. Can you please tell me, I have on file here that we're going to go ahead and do your left great toe. Can you please verify that that is the right location?
Yes, it is. Are you going to take all of it or just some of it?
Just the partial. Thank you for asking. So we're going to go ahead and get started. We would get you in the proper position, which would be your knees flexed on the table. We'd have you laying down with your knees flexed and your foot flat on the table. And then I'm going to go ahead and go over all of our supplies, and I'll tell you what we're doing as we do it, and please feel free to ask any questions as we go. So we are going to go ahead and use our clean gloves for the digital block. I have our 10 ml syringe that we've already drawn up our lidocaine, our 1% lidocaine. And then I drew it up with a bigger needle, and then we're going to use the 27 gauge 1 1/4 length needle to do the infiltration, the local infiltration. That's all we're going to use for the digital block, as well as I have our betadine on a gauze that we're going to go ahead and use to clean it with. And then for our other procedure for the toenail removal, it is a sterile procedure, so we have sterile gloves. We have a sterile package here that we've already started to open, and in it we have 4x4 inch gauze soaked with the betadine. We have several different gauzes. We have a fenestrated drape, iris scissors, bandage scissors, 2 straight hemostats, a sterile tourniquet, as well as our Telfa dressing with our Neosporin so that it doesn't stick as it's healing. And then we'll do a bulky dressing at the end to ensure that it is covered and won't get infected. So we're going to go ahead and get you prepped here for your digital block. Do you have any questions before we get started?
No, I don't think so.
Okay. So I've already pulled up the solution. We're going to go ahead, the lidocaine solution for numbing. We're going to go ahead and switch the needle so that's ready. We're going to go ahead, this has betadine on it for our gauze, so we're going to go ahead and get you cleaned up. So we're just scrubbing the area. And then once we've scrubbed it with our betadine, we're ready to go ahead and numb it. We're going to use the H method for infiltration. So what we'll do is we'll start on the lateral aspect of the toe. We'll go ahead and aspirate back to ensure that we're not in a vessel. And we'll go ahead and insert the solution on the way back. And then the important thing is that we're not going to use more than 2 to 3 mils of lidocaine. We're going to go back in the same area that we've already numbed to numb across the top, the distal portion here. You want to go all the way over without going out the other side of the toe. And pull up, aspirate, and then insert as we're coming back. Again, only using about 1 to 3 mils of lidocaine. And then to make sure, we've already numbed this side and the top, so now we need to go ahead and numb this side using the H method. I'm going to go ahead and insert on the medial portion here, aspirate, and then insert as we're coming out. We would go ahead and wait 10 minutes for that to take effect. Alright. right, it's been 10 minutes, so we're going to go ahead and do our sensation check. We checked your sensation prior to the start of the procedure, the digital block, and we noted that you had proper sensation. So this time we're going to go ahead and check the same things. So what I'm going to do is touch your toe and your toenail with this needle. Please tell me if you feel a sharp poking sensation or just a pressure.
Which one should I feel?
You should feel pressure.
Okay.
It's normal to feel pressure, but you shouldn't feel pain.
Okay.
Okay. Can you feel that?
No, not really.
Okay. What about that? Pain or pressure?
Just pressure a little.
Okay. What about that? Pain or pressure?
Pressure.
Feel this inside here. Pain or pressure?
Pressure.
Pain or pressure?
Pressure.
What about under the nail here? Pain or pressure?
Pressure.
Over here on this side, pain or pressure?
Pressure.
Pain or pressure?
Pressure.
Pain or pressure?
Pressure.
We'll feel right up here. Pain or pressure?
Pressure.
And then right on your nail bed. Pain or pressure?
I don't feel anything.
Okay, perfect. Well, it looks like you're all numbed. We'll get you ready for your toenail removal, partial toenail removal. I'm going to switch gloves here. Do you have any questions before we get started?
No, just ready to get it out.
All right.
It's been hurting.
Okay, here we go. I'm going to go ahead and prep our field. We got some gloves that seem to be difficult here today. Maybe my assistant didn't do a good job. All right, how are you doing, Tara? Okay, I'll be ready in 1 minute here. Let me pull my fingers out. Okay, we're going to go ahead and get started here. We're going to go ahead and get you draped. Who knew toenail removals would be so much fun? Okay. All right, we're going to get you cleaned up here. We're going to use our betadine solution. And we're going to go ahead and scrub your toe again, just like before. Are you feeling any pain with the scrubbing?
No.
Okay. We would make sure you're nice and clean. Then we're going to go ahead and get your tourniquet on here. The tourniquet is going to go ahead and give us a bloodless field, so we don't have to worry about as much bleeding during the procedure. Okay. Then we're going to go grab our tools here. So with our scissors, we're going to go ahead and loosen up the nail bed here. And go along the top portion here and then all the way around, loosening it up and underneath to make sure that we're not going to harm the nail bed when we remove the nail. Make sure it's nice and loosened, and as you can see, it's coming up very nicely here. And then what we're going to do is go ahead and cut the lateral 1/4 to 1/5 of the nail up to the nail bed as far as we can go. Okay, and then we're going to go ahead and take our hemostats. And stabilizing the toe, we're going to go ahead and grab that nail that the partial nail that I just trimmed off, and we're going to go ahead and do a turning motion to get that partial toenail removed. As you see, it came off very nicely. We didn't miss any fragments. And then we're going to go ahead and release our tourniquet here. And we'll go ahead and get you dressed. We're going to use our Telfa with our, which I had setting out, my assistant here. We got our antibiotic ointment bacitracin that we've put on our Telfa pad so that it doesn't stick. We're going to go ahead and do that, and then we're going to use a bulky gauze dressing. And we would go ahead and use tape or Coban to secure that. Do you have any questions about that so far?
No, I think that's good.
Okay. And then as far as aftercare, we're going to send you home with aftercare instructions that you can refer to. We'd like you to go ahead and keep this dressing on for the 24 hours. After that, you're going to go ahead and use bacitracin once or twice a day, as well as I would do daily dressing changes with your bacitracin. You want to clean it with soap and water at home. Refrain from any vigorous exercise for the first week, and watch for signs and symptoms of infection such as redness, swelling, a dramatic increase in pain after the first day, any odor that you smell, fever, anything like that, you want to go ahead and return. And you can use Tylenol and ibuprofen for pain control at home. Tylenol every 4 to 6 hours and ibuprofen every 6 to 8 hours. And then you'll want to just keep a close eye on it. If your toe turns blue or you lose sensation, anything like that, you also need to return and let us know immediately. Do you have any questions that I can answer for you?
Nope, that's it.
Okay, thank you.